Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, we are going to be talking about Bell's palsy today. Let's start. So today we're going to be talking about facial nerve palsy or unilateral facial paralysis or paresis, known as Bell's palsy. Now, Bell's palsy is basically what happens is that one side of your face is actually paralyzed, unfortunately, which can lead to a lot of compromise on the quality of life, especially if you're a person dealing with people and at the same time the facial profile is required in your line of work. So what are the signs and symptoms of facial nerve palsy? Basically, you get unilateral facial nerve paralysis. That means that one side of your face cannot be felt and you cannot make any movements of the facial muscles, because of which obviously you will have problem in speech, because one side of your lips will not be functional. At the same time, you will not be able to blink the eye. Now, be advised, this can be very distressing for people because of the fact that it is a quality of life issue. However, the silver lining is it is usually self-limiting and goes about in about 3 or 4 weeks. It actually is transient. So people who are going through this, my empathy for your discomfort, but let me tell you, there's a silver lining to this. It is usually transient. That means after a few weeks it actually goes back, and most of the cases actually end up having complete return of the nervous function and that side of the face. Now, if you are suffering from it, what are the signs and symptoms you can see? It's basically that you cannot open your mouth on that side because of the fact that the lips will be sealed. At the same time, you won't be able to feel that side of the face and your eyes will not blink. So if you ask someone with Bell's palsy to smile or show their teeth, they will have that kind of a grin thing because that side will not be able to function. At the same time, they're not able to close their eyelids of the affected side because of the fact that the muscles are kind of paralyzed. They might roll up the eyes, but they will not close. Now, coming to the treatment is usually steroids and antiviral agents. At the same time, if in very severe cases where the palsy has lasted for a very long time and there's no return of function, you might want to go for surgical decompression of the facial nerve. However, most of the times, in most of the cases generally are self-limiting over about 3 to 4 weeks period of time. And of course, you might require some physiotherapy. At the same time, some add-tear kind of teardrops, because of the fact that the lubrication of the eye would be hampered because of it not closing. So this was today's episode. Please like, share and subscribe, and don't forget to press the bell icon for important updates. If you want to do a WhatsApp consultation with me, please message me before calling, as I might be busy with the patient or otherwise. And make sure that you have taken good care of your oral health and oral health. That's it for today. Thank you.